welcome back to AGAPE VLOGS. This time I'm back too fast, right? Well, I would like to congratulate all those who have cleared their CBT exam in the last weeks, and I would also like to share your pictures if you forward them to AGAPE VLOGS @gmail.com. And I welcome all the new subscribers who have walked in recently. This is continuation of test 5 from questions 11 to 20. So please don't forget to refer to the previous vlogs, that is on test 1, 2, 3, 4 and 5 from questions 1 to 10. So that good luck to all those who are taking your exams these days. And I'm advising all of you to note your scores, and at the end of the test 5, that is after completing the 50 questions, you will know your status. So please note down your scores. So coming on to the 11th question, dehydration is of particular concern in ill health. If a patient is receiving intravenous IV fluid replacement and is having their fluid balance recorded, which of the following statements is true of someone said to be in a positive fluid balance? And the options are: option A, the fluid output has exceeded the input. Option B, the doctor may consider increasing the IV drip rate. Option C, the fluid balance chart can be stopped as positive. In this instance means good. And option D, the fluid input has exceeded the output. So what is the right answer? The right answer is option D, that is the fluid input has exceeded the output. Okay, moving on to question number 12. As you all know, the last vlog was just 4 days back. I have come back so fast just because many of you were messaging me that you're taking your exams this month or in August. So for your help only, I have come this fast. So make the best use of it. Let's go on to question number 12. So let's move rather fast. Question is, what specifically do you need to monitor to avoid complications and ensure optimal nutritional status in patients being enterally fed? Options are: option A, blood glucose levels, full blood count, stoma site and body weight. Option B, eyesight, hearing, full blood count, lung function and stoma site. Option C, acid swallowing, patient choice, fluid balance, capillary refill time. Option D, daily urinalysis, ECG, protein levels and arterial pressure. The right option is option A, blood glucose levels, full blood count, stoma site and body weight. Hope all of you have got it right. And let me remind you, these questionnaires you have to really think and answer. You will be feeling that it's very easy and you will just pick any answer. Please use your brains and find out the right answer and only tick them. 13th question, a patient needs weighing as he is due a drug that is calculated on body weight. He experiences a lot of pain on movement, so is reluctant to move, particularly stand up. What would you do? Options are: option A, document clearly in the patient's notes that a weight cannot be obtained. Option B, offer the patient pain relief and either use bed scales or a hoist with scales built in. Option C, discuss the case with your colleagues and agree to guess his body weight until he agrees to stand and use the chair scales. Option D, omit the drug as it's not safe to give it without this information. Inform the doctor and document your actions. So this is a tricky question in fact, and I guess you have got it right also. The option B is the right answer, that is offer the patient pain relief and either use bed scales or a hoist with scales built in. So that's the right. Question number 14. If the prescribed volume is taken, which of the following types of feed will provide all protein, vitamins, minerals and trace elements to meet a patient's nutritional requirements? Option A, protein shakes or supplement. Option B, SIP feeds. Option C, energy drinks. And option D, mixed fat and glucose polymer solutions or powders. So what's the right option? Option B, that's SIP feeds, is the right answer. I guess all of you know that nutritional SIP feeds can help to bridge the gap between what a person is managing to take as food and what their body needs by providing a balance of all the necessary nutrients, that is the energy, protein, vitamins and minerals. So don't forget it. So moving on to the 15th question, a patient has been admitted for nutritional support and started receiving a hyperosmolar feed yesterday. He presents with diarrhea but has no pyrexia. What is likely to be the cause? Option A, the feed. Option B, an infection. Option C, food poisoning. And option D, being in hospital. Mind you, the answer is option A, that's the feed. Question number 16. Mrs. Jones has had a cerebral vascular accident, so her left leg is increased in tone, very stiff and difficult to position comfortably when she is in bed. What would you do? Options are: option A, give Mrs. Jones analgesia and suggest she sleeps in the chair. Option B, try to diminish increased tone by avoiding extra stimulation by ensuring her foot doesn't come into contact with the end of the bed, supporting with a pillow her left leg inside lying, and keep the knee flexed. Option C, give Mrs. Jones diazepam and tilt the bed. Option D, suggest a warm bath before she lies on the bed. Then use pillows to support the stiff limb. So what are you going to do in this case? In this situation, you will have to try option B, that is, try to diminish increased tone by avoiding extra stimulation by ensuring her foot doesn't come into contact with the end of the bed, supporting with a pillow, her left leg inside lying, and keep the knee flexed. So that's what you're going to do, and that's the right answer. Hope you got it right. Question number 17. Which of the following is a behavioral risk factor when assessing the potential risk of falling in an older person? Option A, poor nutrition or fluid intake. Option B, poor heating. Option C, foot problems. And option D, fear of falling. Option A, that is poor nutrition and fluid intake, is the risk factor in this case. Okay. If you like my video, please don't forget to show it. So going on to the 18th question. When positioning the supine patient in bed, why should you ensure the patient is lying centrally in the bed? Options are: option A, to ensure spinal and limb alignment. Option B, to ensure patient comfort. Option C, to ensure the airway is patent. And option D, to minimize the risk of injury to the practitioner. So what's the right choice? Option A, that is to ensure spinal and limb alignment, is the right answer. Okay. Very fast, we have reached the 19th question. In what instances shouldn't you position a patient in a side-lying position? Options are: if they are pregnant. Option B, if they have a spinal fracture. Option C, if they have pressure sore. And option D, if they have lower limb pain. Which one is the right answer? Is it confusing? The right option is option B, that is, if they have a spinal fracture, you shouldn't position a patient in a side-lying position. Okay, let me tell you what triggered me to come back with the video very fast, that is your comments. So if you have reached the last question, don't forget to give me your comments. It's very valuable for me. Now let's go to the 20th question. What does muscle atrophy means? All of you knows that. No options required. Still, option A, none. Option B, loss of muscle mass. Option C, a change in the shape of muscles. And option D, disease of the muscle. So what's the right answer? Option B, that is loss of muscle mass. All of you got all the answers right. Okay, please don't forget to give me your comments. Do prepare for your exams very sincerely, and you are going to be the best. Okay, all the best for your forthcoming exams. Do come back with the results. Forward me your photographs to AGAPE VLOGS @gmail.com. So wishing you all the very best and keep rocking. Bye friends.